Media. This is Healthcare Musings. I'm your host, Dr. Hashem Hasabala. Welcome, everybody, to Healthcare Musings. I'm so honored and delighted to have Dr. Joseph Marine on the show today. Dr. Marine is professor of medicine at the Johns Hopkins School of Medicine. He's also vice chair of the division, and he's a section chief of the community section of the division of cardiology at Johns Hopkins. I read a lot of his writings and his thoughts on the pandemic in the Sensible Medicine podcast and Substack. And other things. I think his perspective is great now that it's been 6 years, almost to the day, to when I saw my first patient with COVID in the Chicago suburbs. All those years ago. It seems like an eternity. And now I think we have the benefit of hindsight. We have the benefit of not fearing for our lives when we first started seeing these patients. And so I just wanted to kind of get a COVID post-mortem with Dr. Marine. So Dr. Marine, welcome to the show. Happy to have you.
Thank you. Thank you very much for having me. It's a pleasure.
So let me just kind of frame it, what it was like for me. So we knew we were reading the news. We started hearing colleagues on the coasts, on the East Coast and the West Coast, because I'm in the Midwest here. So it took a little bit to get to us, right? And we were reading all these things on social media, and people were saying this is what we're doing. And we had colleagues in California calling, saying this, we're seeing all these cases, and colleagues in New York were calling, crying, and so we had time to plan, and then, the first patient came in March, and it just was relentless. That entire spring kind of calmed down in the summer, then really got bad in the fall again, and then the vaccine came out, and then it started getting better, but then everyone who came into the hospital after that were unvaccinated, right? So when I first, the first emotion that we were practicing with was fear. Right, there was fear of this unknown virus. Doesn't know what it does. We're watching people die before our eyes. We don't know. We're not getting clear on what kind of a virus it is. And we know it's the coronavirus, but is it different this time? What is it doing? It was just, there was so much confusion and fear, and we came very close to running out of ventilators at my hospital. Right, my entire ICU was full of ventilated patients. I had another section, non-invasive, and then we had a clean ICU with other patients way far. It was really very, very difficult. And we worked hard. We shed tears. We lost patient after patient. That was the milieu we were practicing. And so everything that came out of that. And now there's a lot of things we realized we did wrong. At the time, it was really chaotic. What did we get right, and what did we get wrong?
Well, that's it's a big subject to tackle, and I think you mentioned fear a lot, and I think that one of the things that we certainly did wrong is there was too much fear. The fear I don't think helps when you're facing a crisis situation. I understand there's many challenges that occurred in the hospitals. My own perspective in Baltimore is that we also saw the news coming from China and from Italy and hearing from New York, and we, prepared by essentially shutting down all of our clinics and all of our outpatient activities at a time when we didn't have a single case. And that, struck me even at the time as a bit of an overreaction. Why don't we prepare and continue to do our jobs? I mean, it's kind of demoralizing for the physician community to be told to stand down and just kind of wait. Our experience in Baltimore was a little bit different. We certainly had plenty of COVID cases. I think our peak census in our 1,000-bed hospital was around 130 or 140. We did have to convert step-down units into ICUs. In fact, my office is right down the hall from a pulmonary step-down unit that became our main COVID unit throughout the pandemic. And I think we had to stand up 5 or 6 different new ICUs. We did have to do major reorganization of staff, come up with volunteer pools of people who would, pitch in to do X, Y, and Z. And I think, everybody pretty much stepped up. There was some fear, particularly for our older faculty and staff and, people who were known to be at higher risk at that time. But I think, most people just approached it as a challenge to be faced, and I think that was, that was the right way to do it. It turned out that, we probably could have kept more of our existing operations going at the time. Of course, people didn't have a way to know that at the time, so I think it's understandable. Um, but I think we managed we managed quite well in Baltimore. At the time, I was president of the local cardiology society, so I was in touch with cardiologists around the state in other institutions, and we were concerned very soon about how few patients presenting with cardiovascular disease. We were seeing a dearth of presentations for heart attacks and strokes, and so we organized to try to combat the fear that people had of coming to the hospital. There was immediately a sense that, the hospitals are, overwhelmed. The hospitals don't have the capacity to care for me. The hospitals are filled with this virus. And so I think that was an example of too much fear that hurt people and prevented people from coming to get care. So we had to actually try to organize a campaign to get out in the local news that things were not so bad that you couldn't come and get care in your hospital. I actually had one patient who presented late with complete heart block and stayed at home probably for a week with symptoms, and by the time they got to the hospital had renal failure. Much later presentation than one typically would have for AV block. And the patient said to me, I was afraid to come here because this place is just crawling with this virus. And so that really hit home for me how much the fear had overtaken reason and kind of common sense. So I think, it certainly was a crisis. It's something that we needed to prepare for, particularly in big population centers. And it's very clear that the densest population centers tended to have more COVID and more strain on the hospital system. So I wish it could have been done with a little bit more balance and a little bit less fear. And I think that's the way they did in the subsequent waves. We kept almost all of our operations open in the subsequent waves of COVID, and that was a great challenge. There's no doubt about it. But I think overall too much fear and not enough normalization of activity. So I remember very distinctly in the hospital, I think around the middle of April, when cases had clearly peaked, they were clearly starting to go down. We were clearly managing. Never ran out of anything, even though, as you mentioned, it was a strain. And I was saying to myself, well, they're going to normalize things very soon and get back to normal very quickly. And it turns out that, once you do something so extreme as locking down the entire country and closing so many aspects of our health system, it's not so easy to get back to a normal state, and that certainly proved to be true.
Throughout that, in the beginning, we kept talking about bending the curve and preserving resources for scarce resources. Like we almost ran out of ventilators, and we didn't want to make that decision of who do we pick, right? If we have one ventilator left and I have two people that need one, I didn't want to make that choice. Thank God I never had to make that choice. But that's kind of where the impetus would. I mean, and I said it too. Stay home. Stay home. Stay away. 6 feet apart. All that because I was in the hospital getting inundated and overwhelmed with patients with coronavirus. I mean, it was and we had no real treatments. We had steroids or whatever, but they were dying one after another after another. I mean, that's where. Because I saw it with my own eyes, and we were just trying to preserve the capacity of the healthcare system, but that's where this whole thing with the schools and locking down the schools, which looking back was probably a huge mistake. I mean, the kids really were hurt. My own kids included were hurt by that. Were hurt by shutting down the schools. I mean, that's where I came from it, just trying to protect the scarce resources that I had.
Absolutely, and that's a worthy goal. I remember that whole debate, that argument, and the graphs that they would show in the newspapers of the big spiky curve and all the exceeding hospital capacity, and how they were simply trying to flatten the curve, broaden out the cases. Right, that was the whole argument. There was no concept early in the pandemic that we were going to control the virus, that we were going to eliminate the virus and bring cases down to zero. It was simply to, as you said, flatten that curve, broaden out the curve so that it would be more manageable for the system. I think it's debatable how much the mandatory aspects of the lockdowns really accomplish that goal. I think that's going to be debated for a while. It's a lot of hypotheticals, a lot of counterfactuals that you can debate what would have happened X, Y, Z. What I do remember seeing is that there was a great deal of activity by Google mapping and GPSs of people activities that businesses and people took voluntarily before lockdown orders came. And I think the chief point of debate is how much should have been voluntary and how much should have been mandatory. And I think that once they went to a mandatory sort of militaristic approach, that alienated a lot of people, particularly when that authoritarian approach was continued far too long after the acute crisis ended. And I think the mandatory aspect of it, which is so abnormal in a free society, is also part of what alarmed and perpetuated the fear that kept essentially a lockdown mentality going far longer than it needed to. As far as the schools, I think that's another aspect. Certainly reasonable to have closed schools for a short period of time in the immediate aftermath. It was just that fear that gripped society made it so hard to then reopen them. And I think that's going to be the future question if we ever, have such a health crisis again, is when you take these extraordinary steps, they're very, very difficult to reverse. And that has to be factored into that initial decision.
Yeah, absolutely. I remember like the whole and masking. So I remember, my son and I, it was 4th of July. It was, the lull. There was still a lot of cases. We went to get fireworks and I wore a mask. He wore a mask. It was a packed store. We didn't get sick. So, I think there was something to wearing a mask in a crowded area. Masking a 2-year-old child, I thought seemed excessive and ridiculous. But everyone's like, oh, masking didn't make a difference. Masking didn't do that. But we had zero flu that year. Zero, none. I had no cases of flu, and that's very atypical for any winter season. 0 cases of flu or RSV or anything. So I thought, masking must have had an effect. Just from anecdotally and just from what my practice was, it's not a randomized trial, and still, it seemed to have made an effect. What are your thoughts there?
Yeah, masking is a whole separate issue. I remember that debate and how initially they were telling us not to use masks. They're not effective. And, if you go back and look at the influenza literature, there is quite a number of randomized controlled trials suggesting very little, if any, effect of cloth and ordinary surgical masks in spread of influenza. And there was a whole debate initially early on as to whether COVID was spread by droplets or whether it was aerosolized. And ultimately determined that it was aerosolized, so less likely that a ordinary cloth or surgical or ear loop mask would make a significant difference. I was aware of some of the early data and the modeling studies suggesting that it would be helpful. So, I initially had no issues with wearing masks, and I wore them everywhere I was required as well, although I was a little skeptical that it would be helpful, but there was still some thought that it was spread through droplets at the time. And I also thought that, the masks hopefully will psychologically help, as nothing else, to get people out of their bunker mentality, to come out back into society and interact with each other. And so I thought, masking from that standpoint is also probably a good idea. But again, when it was dragged on for so long and in contexts where it didn't make any sense, like out of doors and, young children, and it was clearly sort of so much overkill and over authoritarianism aspect of it is what I think turned a lot of people off. And I think ultimately the public health community burned a lot of capital and goodwill on the masking that could have been better put to interventions that were more effective, such as the vaccine.
Yeah, that's a great segue to the vaccine. I remember reading one of your pieces about more bad news for the messenger RNA vaccine. I had contracted COVID in November of 2020, right before the vaccine came out, and I still got vaccinated. After I recovered, I took the first series and I got one booster, and I've stopped since. But I really think the vaccine made a difference. Like everyone after the vaccine in that second in 2021. Everyone that we saw universally, 99% were unvaccinated. All the people who got vaccinated didn't get to the hospital. It doesn't mean they didn't get COVID necessarily, but they didn't get to the hospital. They're not on BiPAP. They didn't get pneumothoraces. I didn't have to put a chest tube in. All those things that we were doing well into April, May of 2021, they were just all people who did not get a vaccine for whatever reason. So the vaccine must have made an effect. I mean, was that what you're seeing?
Yes, we saw the same thing. And again, there's epidemiologic reasons why that might be the case, but I think there was certainly a real effect of the vaccine early on. I remember all the excitement that came out. I read the New England Journal articles, the pivotal trials. As soon as they came out, they were very convincing at the time, even though the numbers of hard endpoints are really too low to draw conclusions as to whether it would reduce mortality. But I was all in on the vaccine. I got it as soon as I could. I volunteered to, we had pop-up clinics so that we could get all of our faculty and staff vaccinated as soon as possible. I participated in that. I vaccinated a couple hundred of my colleagues before I was in line to get it myself. I encouraged, through my role as the state society leader, to encourage all of our members to get involved, get vaccinated as soon as possible, to encourage our patients, almost all of whom have heart disease and therefore would be at higher risk, to be vaccinated. So I was all in early on, and clearly our nation and our public health apparatus had committed to this idea that the only way out of this abnormal, extraordinary state is widespread vaccination. So as far as what we saw at Hopkins, we certainly saw a very, very high proportion of patients initially were unvaccinated. By the time the later fall rolled around, though, that did move to more like 50-50. So clearly there was some early signs of waning effectiveness that, was acknowledged as well. It was also very clear. I remember in July 2021, when the reports came from UCSF and Provincetown, Massachusetts, of huge outbreaks in highly vaccinated populations, that this idea that the vaccine was going to end the pandemic, for me, immediately ended then and there. And I think that was a real critical point in our country in July 2021, that the public health leaders could have taken a very different approach. They could have leveled with the public and said, this is the best we're going to do. We have this vaccine that mitigates disease in high-risk populations. They should all get vaccinated, for those who haven't yet. But by July, almost all high-risk people had, in fact, been vaccinated. It was mostly just younger people and people who had already had COVID that weren't getting the vaccine. We already, I think, did a pretty good job as a country of getting many people vaccinated by that point. But they could have leveled with the country and said that, this vaccine is not going to stop spread. It's not going to end the pandemic. But we have therapies. We have mitigation tools. We have to get our country, back to a normal status. But they instead took a very different point and said, mask up again, starting the testing and tracing, and, getting all of this excitement about variants going. So I think that was a real pivot point. One pivot point was early in the pandemic in April, May, after the initial wave first came through, which was much less severe than the models predicted. There was one opportunity there to try to tamp down the fear. And I think there was a second opportunity that was missed in July 2021 to be more realistic with the public about where we were and what we could accomplish. I think this idea of zero COVID and crushing the curve, I didn't mention that, but in that first wave in the spring of 2020, as we talked about, the initial goal was to flatten that curve, and that's what all the pictures were. There was no illusion that we were going to eliminate or control COVID. But I think that once the lockdowns took place and they could see that they had the public under their control, they really moved the goalposts to crushing the curve. And there was an article, an editorial in the New England Journal proposing that we continue these extraordinary measures for 10 more weeks to try to completely eliminate COVID or suppress it completely, as China did. And I remember reading at the time, that's a totally crazy idea that's going to destroy American society. I think that was one of the frustrations of a lot of the COVID dissidents, that they kept moving the goalposts and changing the goals.
Yeah, and I think that was a problem, is that the messaging was muddied. Is this aerosolized? Is this droplet? Does it hurt? What does it do? I mean, we're seeing at the bedside, it's literally killing people. And okay, but how about my family? There's no, and I don't. Did they not trust the public to understand nuance? Is that right? I mean, did we infantilize the public and not trust that they're going to not understand nuance, and this has to be this way? even though maybe people are smarter than the establishment made them out to be?
I would say so. Absolutely. I think the public messaging was too simplistic, and there was not enough action to try to tamp down fear. I think they kind of used fear in a way as a weapon to control the public. There was a lot of concern, I think, that if you do anything to tamp down the fear, then the public will go too far in the other direction. That may have been the mentality. I'm not really sure. And I read Scott Atlas, who is a public policy expert from Stanford who joined the White House coronavirus task force team and tried to be a sort of a counterpoint to some of the more extreme actions and fear-based messaging that was occurring. He writes in his memoir that he had interaction with Dr. Fauci in, I think, around July or August, saying, isn't there too much fear going on? Shouldn't we do something about this? And, Dr. Fauci responded something like, they're not afraid enough. And I think that was a fundamental tension, is how much fear and concern to allow to occur in the population. I would have much preferred that there be much less fear-based messaging, much more reassurance, and much more trusting of the public to be given information. I mean, that's really how public health has always worked in my mind. Their job is to assemble and disseminate information and advice and guidance, and not really to control and to mandate, and being much more authoritarian. Now, I was a medical student in San Francisco in the late 80s, early 90s, at the peak of the AIDS pandemic that was occurring there. At that time, AIDS was a 100% fatal disease. I think during my medicine third-year rotation, every single patient that was on our service was a young man with advanced age and all of the opportunistic infections. So, that was kind of my second pandemic with COVID. My first, was AIDS, and the public health response to that was so different. It was much more trusting the public, giving them information, not controlling people's behavior, but giving them advice and hoping that they would encourage them to do the right thing to slow the spread. So this was obviously a very different disease, very different mode of spread, very different consequences. But, I wish there could have been more of that public health that I knew as a medical student during the COVID pandemic.
Yeah, that's true. And it was a different disease, though. It wasn't like it was a different disease. HIV was a different disease. AIDS is different than COVID. How about I always felt that the risk of the virus to the heart was higher than the risk of the vaccine to the heart. Is that didn't turn out to be? Did that not turn out to be true when it comes to young men, when it comes to young people, or was that still the case?
That's still debated. There was an early paper that came out of MRI done in young people who had got COVID that showed some delayed gadolinium enhancement, a marker for scar and inflammation and myocarditis, suggesting that the prevalence might be quite high. And I remember that triggered a lot of concern in the athletic medicine community and what to do with sports and NCAA athletes and so forth. That turned out to be greatly overblown, and the clinical incidence of COVID myocarditis was far less than that. On the other hand, there was concern raised by the vaccine early on. I saw 2 cases of COVID vaccine-related myocarditis myself. So, my own experience suggests that perhaps that was more prevalent than was initially reported. I think that, that whole debate is still ongoing. There was just a reassessment done by some colleagues of mine suggesting that the analysis of the weighing the risk of COVID myocarditis versus vaccine myocarditis that was initially done by the FDA didn't account for some variables that they should have. But those are hard questions. But I think that clearly it was a concern, particularly in young men, young males. But it seems to be occurring less now than it did with the first round of injections.
Yeah. I mean, the virus is completely different now. I mean, it's continually mutated to become much less virulent, which makes sense from an evolutionary perspective. And now I'm not recommending anyone get a vaccine. I'm not going to get a vaccine against COVID now. It's just a different virus now.
Yeah, that's a whole other issue, is why, in terms of messaging, I remember when the Omicron wave hit South Africa, and the public health experts there were like cheering that this is, a miracle, that this virus has become so much less virulent. It's almost a different disease now. And somehow that message didn't get translated into the Americas, and it was really all this fear over Omicron. And I think we'd gotten so locked into this fear-based mindset that we didn't really take the good news of Omicron that we were getting from South Africa as seriously as we should.
Yeah.
I don't know what you remember from that time.
I do. No, you read the papers, like they're just saying, oh, test every time, test. It was like it was ridiculous at some point. Like, you can't go to your parents' house. No, you should test. And it just seemed so neurotic, and the messaging. And at some point you're like, okay, come on. I mean, I get it, but it's different now. It's a whole different disease.
They really got locked. They really got locked into a zero COVID mentality that never made sense to me, and really wasn't part of the initial response. If you remember, it was flatten the curve, spread out the cases. We're not going to stop this virus. In fact, I think even Angela Merkel in Germany, told her country, everybody's going to get this virus. It's just a question of when. And I think that was the right message, and we should have kind of kept to that more realistic scenario.
And I know you have a hard stop soon. I want to be respectful of your time. This makes me nervous about a future pandemic. Do you think that the public health trust has been broken beyond repair?
Yeah, well, hopefully we're not going to see another 100-year pandemic, in our lifetime. And that gets also to the whole question of where do pandemics come from and what was the origin of COVID.
Right.
But I think, that the trust issue is a very serious one. The current administration, their health leaders are taking that very seriously, and, have expressed as their goal to try to restore trust. I think one element of that is to be coming to some kind of reckoning as a nation of what happened, what worked, what didn't work, what was ineffective, what was harmful. I think there needs to be more conversations among that in the medical community, just like we're having right now. And it's surprising that we're still not seeing that. It's still such a sensitive subject that we're not seeing that in our medical grand rounds, for example, in our medical literature. I hope to see more of that. Hopkins has initiated a partnership with the American Enterprise Institute, trying to bring different perspectives to the COVID pandemic. They've had a couple of seminars already, and I hope we'll start seeing more of that on our campuses.
Yeah, because if the next virus is as contagious as COVID and deadly as Ebola, I don't know what was.
Well, if that were to happen, I think that's going to be a whole different problem, right? I mean, you're not going to have to order anybody into their homes. You're going to have the opposite problem, is how are you going to get enough people to come out of their homes to keep society functioning? So I think that, one pandemic is one pandemic. It's a totally different, just as you said, AIDS was a totally different pandemic. COVID was a totally different pandemic. We have to be, flexible in how we approach each individual health challenge.
Yeah. Well, I pray that day never comes. Dr. Joseph Marine, I really appreciate you. Appreciate your time. Your expertise is wonderful. This is a lot of food for thought. Thanks for all you do, and thanks for your thought leadership in this space.
I appreciate it. Thanks for having me on.
Absolutely. Take care. Thank you for listening. Sign up at healthcaremusings.com to get every episode delivered directly to your email. And please don't forget to leave a 5-star review. Thank you so much.